Hello everyone. I'd like to talk about heart disease today. And specifically, I'm referring to the plaque that can build up in our blood vessels and lead to things like heart attack, stroke, or conditions like vascular dementia. This plaque buildup is otherwise known as atherosclerosis. And there seems to be some confusion as to how plaque can build up in our blood vessels. And I'd like to kind of set the record straight. It's not saturated fat. The science is clear on that. And it's not cholesterol either. The science is also clear on that. What causes plaque to build up in our veins is something called inflammation. So our body makes inflammation to keep us alive. If we get an injury or we get an infection, we need inflammation to come in and circulate through our veins, and it draws in cells from our immune system to kind of take care of business, to fight the infection, to repair damaged tissues. But once the inflammation has done its job, it's supposed to switch off, all right? Because long-term inflammation can cause damage to tissues. So when the inflammation doesn't switch off, yeah, that can harm our own tissues and cause kind of collateral damage. So when inflammation is circulating through our blood vessels on an ongoing basis, even just low-grade inflammation, our vessels respond to that by protecting themselves, by building up a layer of fatty deposit and plaque. It's almost an antioxidant to protect the lining of the vessels from the damage that inflammation causes. And the longer that inflammation is circulating in the bloodstream, the more the plaque builds up, okay? And it gets to a point where eventually, if you're unlucky, a chunk of that kind of breaks free, and that can then circulate, and it can plug capillaries and lead to strokes and heart attacks. And vascular dementia, in fact, is a series of mini strokes that blocks and kills off neurons in the brain, all right? So the question is, what causes the inflammation to circulate, all right? I've already mentioned that it's not saturated fat or cholesterol that causes the inflammation. So we have to look at the diet, okay? What foods are inflammatory? Well, sugar and ultra-processed foods. These are highly inflammatory substances, and if you live on that kind of stuff, you're going to be creating inflammation kind of circulating in your bloodstream all the time. Other things that cause inflammation to circulate: stress, in fact, smoking, infections in our gut. They can create low-grade inflammation. Also, poor oral hygiene. Right? We now have seen studies that look at autopsies of people with lots of plaque buildup, and they find oral bacteria inside the plaque. Okay? So, if you want to avoid plaque buildup, how do you do it? Well, you have to live an anti-inflammatory life. And of course, that means not smoking. That means reducing stress. Stress is an inflammatory condition, right? And let's face it, a lot of us are chronically stressed all the time today. It also means sorting out your gut. If you've got bad digestion and gut problems, see a nutritional therapist and get that seen to. And taking care of your mouth, right? Floss regularly. Keep clean oral hygiene to minimize that bacteria that gets in the bloodstream and causes inflammation. But when we talk about diet, we want to eat anti-inflammatory foods. I'm talking about a diet rich in colorful vegetables and fruits. These are anti-inflammatory in nature. I'm talking about lots of healthy fats and essential fatty acids from nuts and seeds and oily fish like salmon and mackerel and anchovies and sardines and herring, otherwise known as smash. All right, and avoiding inflammatory oils and fats like vegetable oil and sunflower oil. We don't want to cook with those oils. They are inflammatory to the body. Okay? So that's just a few ways that you can reduce inflammation in your body. And yeah, if you want to avoid plaque buildup, live an anti-inflammatory life. I'm going to see you there. Take care.